New research from the Mayo Clinic shows that little kids under the age of 3 that have more than 2 surgeries with anesthesia increase their risk for having ADHD twice over kids that have not had the surgeries.
Yeah.
So we need to talk about if there's alternatives for this.
Well, that too, and also point out that surgery is a big deal. I mean, when you're talking about giving somebody an anesthetic, particularly a general anesthetic, you're putting a foreign chemical into the body that has an effect on our nerve tissue. We know that if we give enough anesthesia to people, particularly people who are on a heart-lung machine for surgeries on the heart, they often come out with a lower IQ. They don't function as well. There's definitely a loss of brain cells there. So when we're doing that to young kids and doing more than 2 or more surgeries to find that there's an increase from 7% or 7.5%, which is the average in this particular study baseline of people who didn't have surgery that had ADD, and it rises to 18%, you know that something bad is happening to their nerves.
Of course, you know, it's not usually an elective surgery, I wouldn't think, when somebody was that young, so they pretty much have to do something.
Right.
But, you know, other countries use things like acupuncture.
I think it could be done, and you're talking about little kids, but you know we do acupuncture on horses and other kinds of animals. It works well, and I remember seeing a video back in the 1960s when President Nixon went to China, was opening up the door there to relations. He brought back with him a video of somebody with an open chest who was eating an orange, only getting acupuncture during the surgery. You would think that after all these years we might have caught on that there's something to this that actually works, and there aren't any side effects from that.
Well, you know too, hypnotherapy works for a lot of people, but I don't know how that would work with a child that was that young.
We'd have to ask the hypnotherapist, because
Yeah.
maybe they have some tools that would do that. So we know that we need to do something that's safe, because what we're doing is causing problems. I know my own example of having had surgery for just a hip replacement using a spinal anesthetic.
We
led
thought that
to
was
disasters.
we thought that would be a safe choice.
Well, that's why I picked it. I thought general anesthesia, I can use all the brain cells I've got, and I don't want to lose any more. So let's do a spinal anesthetic. And what turned out is that during the procedure, when they were injecting some of the anesthesia into my spinal canal, the doctor was doing some work on my hip and moving my leg around, and the anesthetic went up instead of going down, and I wound up with a real problem. It led to peripheral neuropathy and led to loss of control of my blood pressure, which dropped to 60, and I was in shock. So it's like a big thing, and it takes time to recover from things like that.
And especially for the elderly that have anesthesia.
I guess I qualify for that now. I hate to admit it.
Happy
but it's true.
birthday.
Yeah, thank you. That's right. So it's something that we take kind of for granted. In fact, we don't even think about talking to our anesthesiologist much. It's sort of like, I want to get the best surgeon to make sure it works out right, and that's important for sure. But if you don't have a good anesthesiologist, I don't care how good your surgeon is, you may not survive the procedure.
You sure talked to the second one a lot more than the first one.
I interviewed him quite well when I had a second surgery because the first one didn't work out.
Well, many times you don't even meet your anesthesiologist until just before the surgery.
Right. He says, here, I'm going to take care of you. Don't worry. We got everything under control. And you're going, well, what's your record? You know, have you done well? Are you experienced at it? Are you new? I mean, what kind of things, what do you specialize in?
You know, another thing I always like to tell people that are going to have a general anesthetic is to talk to the anesthesiologist and tell them that you want them to be gentle if they're going to intubate you. That's when they put that tube down your throat.
You wake up with a sore throat.
Yeah,
right.
and everybody wakes up with a sore throat. But if they're gentle when they do it...
Well, you just want to have a relationship with your surgeon, with your anesthesiologist. And if you're a young person, you know, you're not under much control, but the parents can do a lot about that. And it could be that kids that have ADD or are predisposed to it don't have the same reserves that people that don't have that problem in their genes. And so it doesn't take much of some kind of chemical to interfere with nerve function to bring out the actual ADD itself. So we're talking about anesthesia and ADD. It's an interesting association. We should do what we can to avoid surgeries, but if we're going to do a surgery, we ought to do the safest kind of surgery we can, and we should be looking at new technologies like acupuncture and hypnotherapy, which aren't that invasive at all and have a good safety profile.